Let's bring in MSNBC medical contributor Dr. Lipi Roy, an internal medicine physician. Dr. Roy, it's great to have you with us as always. So we heard there a few minutes ago that Dr. Fauci is now saying that he hopes he will have enough tests for everyone who needs them by the end of May or the beginning of June. What are the implications of that timing for some of these reopening plans that are already being put into motion across states?
Good morning, Ayman. Yeah, I read that. And I mean, look, we've been saying this for a long time, right? Medical public health professionals, we've really been needing a widespread and accurate testing just to understand the scope of the problem. I fully expect that the number of cases will rise substantially once we get that testing. Again, the concern, though, that most of us have, though, in the medical public health profession is that we need to make sure that the tests themselves are accurate, right? Both in terms of sensitivity and specificity. We've been hearing a lot about all these different companies rapidly creating these tests that are rapidly getting FDA approval, but they've been showing variation in terms of accuracy. There's some false positives, false negatives. So to me, that's what's most concerning. It's great that the tests will be coming out, but I want to make sure that they're validated and producing accurate results.
Yeah, and not repeat what we saw early on when this all began to break out with those initial wave of tests that set us back. There are also concerns, Dr. Roy, about what will happen as we start to see heat waves in the country, especially in areas that remain closed. How should officials factor that into their plans moving forward, if at all?
Yeah, so there's a lot of speculation here in terms of how this virus is going to react in warmer climates. And we're really basing these conclusions on other coronaviruses and other viruses, like say influenza, where cases really dramatically go down during summer months, warmer climates. The short answer is we don't know how this virus is going to respond or behave in warmer climates. It's a new virus, so we just don't know. So because of that, I strongly would recommend, and I think the public health community strongly advises, that we maintain the physical distancing and the social isolation measures because, as you know, Ayman, we don't have a treatment, we don't have a vaccine, we don't really have any other medical tools other than preventive health, public safety kind of measures right now.
And speaking of vaccines, Gilead just released the results of a trial for one of their medications being tested as a potential treatment for coronavirus. What are your takeaways from those results, and how much more testing of this specific drug will be needed before we have a definitive answer about whether it works or not?
Yeah, so Gilead, as you pointed out, Ayman, is the manufacturer for Remdesivir, an antiviral medication. So they just revealed results of a study looking at 397 patients from 180 sites all over the world, countries all over the world. And basically, so these are preliminary results, but they're showing they looked at both a 5 and a 10-day dosing regimen of Remdesivir in patients who were pretty sick. They had severe COVID-19 infection. And what the study basically showed was that it's more beneficial to start the medication early in the disease course rather than late. And the study showed that when you gave the medication early in the disease course, 62% of the patients were discharged from the hospital versus 49% who got the medication later. Again, Ayman, it's important to emphasize that this is an investigational new drug. We need a lot more information, and the plan is to expand this trial from 397 to 5,600 patients. So we just need to keep following the results.
Yeah, and we're going to see more of their findings in a new, peer-reviewed journal in the coming weeks. So that'll be an important piece of data. Dr. Lipi Roy, thank you as always for giving us those facts.